Welcome back. It is time for our Pet Doctor segment. And yes, we're all very happy to have you here, Dr. Larsen. I really mean that. Yeah. I do.
Well, look who's really
look who's
happy.
Here.
I brought Bear, Tim. Bear is 14 weeks old, and those of you that don't know yet what Bear is, he's a Corgi.
And they are just so stinking cute. And he's got a little growl to him.
Oh, yeah, and plenty of kisses going on here.
He's so lovable. I'm going to talk about, maybe Bear at some point has some crusty eyes on there.
Mm-hmm.
You see it a lot. What's going on?
Well, those crusty eyes, as you describe them, may very well be a dry ice problem that the dog has.
Now, is that he's feisty? Is that a syndrome or a condition that they can get, dry eye?
Let's call it a medical condition. He wants to play more than I'm giving.
I know.
Medical condition.
Okay.
It has a nice medical term too. Keratoconjunctivitis sicca, which means dry eye.
All right.
Now, kerato means covering of the eye.
Okay.
And conjunctivitis is the pink membranes around the eye, and they get inflamed. That's the itis part. So inflammation of the cornea and the pink membranes, the conjunctiva of the eye, because of lack of tearing.
So the lack of tearing is a big issue here.
That's what we're talking about. That's what it's all about.
And I would assume the tear has something to do with moisturizing and keeping things the way they're supposed to be.
We got to have tears.
Yes.
If we don't, our eyes do dry out. The drying out for, let's say if he would have dry eye, his eyes would feel like there's little pieces of sandpaper in them.
Be the worst, wouldn't it?
Irritate. He would have mattering of his eyes where the gunk builds up. You clean it out. Next day it's right back again. He may rub his eyes. Be irritated by that. As the gunk builds up, worse and worse. Then we'll get a covering over the cornea, the clear part, so it's no longer clear. They can't see. And as it worsens more and more, they actually develop ulcers on their cornea. Leads to blindness.
Anybody watching at home just completely spaced out. Bear was just staring right at the camera there. Where are the tears produced, and also where do they go?
The tears are produced by tear glands. There's one main tear gland, which is below the third eyelid. Yes, dogs and cats have 3 eyelids. We probably talked about that before. The third eyelid is in the lower, right below the bottom eyelid on the inside. Acts like a windshield wiper blade. Just keeps the cornea all nice and clean. So there are other tear glands around the conjunctiva that produce a little bit of tear, but by far the third eyelid produces the most.
Why would they stop producing tears?
Well, there's probably 2 or 3 main reasons. One reason, and the most common reason, is his body produces an immune reaction to the tear gland. Why? We don't know.
Okay.
But when it does, the tear glands get damaged and aren't able to produce enough tear. Get a dry eye. Now, also, there can be a nerve damage to the eye, to the tear glands, and that will cause less tear gland produced. Also, some viruses may cause it too.
And how do you treat it?
Well,
get some Visine and drip it in there?
That will help a little bit. We use drugs that will help that tear gland produce more tear, maybe work out more tear. Now, sometimes there just isn't enough tear gland left that it can do that. And if that's the case, then we use liquid tears of some type that replace what he's having. If that doesn't work, then we can actually do, now this is beyond my capability, but the specialists can do this. They take a tear gland from the parotid salivary gland. It's not a tear gland anymore. It's a salivary gland. They bring it up like a tear gland and transplant it on the eye.
Really? That's incredible.
That's probably the best way to do it, although it's not the cheapest.
Yeah, no kidding. All right, Bear, we're going to have to let you go. I feel like we need to let you run around a little bit.
He's a pleasure to hold, though.
Thank you, Dr. Larsen.
You're welcome.
We'll be right back.